Additionally, Peter, real quickly, additionally, I wanted to add that we also look at areas that we could help to subsidize our elderly care in respect to retrofitting them home, so that they could be a lot more comfort and convenience, such as removal of tubs. A lot of times there's difficulties in being able to enter these tubs. You want to remove those tubs and subsidize by providing the funding to remove the tub and place a shower. If there's a need for us to build a ramp, so that they could be easy access, so they don't have to use stairways and present some challenges there. We also want to take a look at our private sector and, come up with a universal insurance to be able to cover our private sector. We know that we subsidize as a government, our government employees, but we still have a lot of uninsured and underinsured individuals in our private sector. We want to see how we could close that loop, because if we don't pay on the front end or the back end, we're bleeding, no pun intended, almost $60 to $80 million in uncompensated care every day. Every year, annually. And if we want to be able to close that loop, we also want to work with the next delegate to Congress to ensure that we close in that loophole, that gap that continue to disallow the equitable reimbursement on par with the U.S. as it regards our TEFRA rebate and that funding that comes back to our healthcare system. And that's certainly the Wang Louis Hospital, the Royal Leicester Snyder Hospital, as well as the our medical centers, the Frederickson Health Center, as well as the East End Medical Center. So we do have a plan to address our healthcare system. We have also even discussed, when we talk about quality health care, we can't leave out our acute health care and our urgent care center. They should all be a part of that, as well as telehealth. Telehealth can be critical in the next administration, as well as we are able to address some of those specialties that we don't have here locally, and even developing a private partnership in those areas of specialties that we can't provide here in the Virgin Islands. But the bottom line is that we can't continue to bleed. There's this $80 million. We want to be able to spend that money and have it circulate here in the economy of the Virgin Islands.